My name is Katie Stout. I'm the athletic trainer for the Muskogee Public Schools. This is my assistant, Mackenzie Foreman. She's a senior in the class of 2018, and thank you for coming to help me, Mackenzie. Today we're going to go over hands-only CPR. How do I know if someone needs CPR? When you see a teen or adult suddenly collapse, chances are they need CPR. Tap the person and shout, "Hey, are you okay? Are you okay?" If you do not get a response, begin the steps of hands-only CPR. If the person is gasping for air in spurts, go ahead and perform CPR. Why do we perform CPR? 383,000 cardiac arrests occur outside of a hospital each year. 88% of cardiac arrests occur at home. What is hands-only CPR? Hands-only CPR consists of pushing hard and fast on the chest of a rate at 100 to 120 compressions per minute. How much can CPR improve the chances of survival? CPR can double or even triple the chances of survival. Why hands-only CPR? The number one reason people give for not performing CPR is because they don't think they're going to perform it correctly. Remember, any CPR is better than no CPR. What about giving rescue breaths? When a teen or adult suddenly collapses with cardiac arrest, his or her lungs and blood contain enough oxygen to keep vital organs healthy for the first few minutes, as long as someone provides high-quality chest compressions with minimal interruption to pump blood to the heart and brain. Steps for hands-only CPR. This is when Mackenzie will step in and help. Assertively tell someone to call 911. If you are by yourself, call 911 before starting CPR.
Hey, are you okay? Are you okay?
Start CPR. Push hard and fast in the middle of the chest. Things to remember when giving hands-only CPR. Kneel beside the person, as Mackenzie is here. Put the heel of one hand in the middle of their chest. Put the other hand on top of the first hand. Push down hard and fast, at least 2 inches. Don't be afraid of pushing hard. Mackenzie, show them your hand placement and your hands. Hands only going over the top of the other. Let the chest rise back up after each compression. Continue compressions at a steady beat. The song Staying Alive is the beat that you're trying to stay at. Don't stop CPR until help arrives or the person responds. Helpful hints. Get directly over the person and keep your arms straight. This allows you to keep your entire body, or to use your entire body, which will make it easier. If you have help, take turns performing CPR. As you can see, Mackenzie's shoulders are over her hands, elbows are not bending, so she can use her entire upper body to help. It is important to continue CPR until help arrives, meaning a EMT, a physician, myself as an athletic trainer. This last section we're going to go over is the AED and placement for using an AED. This blue and green AED is only for demonstration purposes only. Whenever you have a person down and you're giving compressions, send someone to go get an AED. The first thing that we're going to do with these two AEDs that I have here, all you have to do is open them and they'll automatically start talking to you and telling you what to do. These don't have an on button. They turn on whenever you open it. You get the pads out and they show you where to put them on the chest. It's upper right and lower left. Mackenzie is going to put them on the patient, a proper placement. That's on the lower left. And upper right. Once they're on the patient, the AED will talk to you and tell you to stand clear, analyzing. Whenever it analyzes, make for sure everyone is away from the patient because it will sense your heartbeat. If it says shock, it'll say stand clear as well. The AED in the back, we're going to open and it'll start talking and it'll walk you through what you need to do. And it'll turn on.
Stay calm.
And start talking to you.
Follow these instructions.
So you're just going to follow the
Make sure
instructions.
911 is called now.
The AED is foolproof, and if you have trouble, ask for someone else to help you.